Okay, this video is a book review. The name of the book is Cancer, A Second Opinion. Author is Josef Issels. He's like from Germany. Why did I read the book? Because some of these dentists recommend it. They said this guy has good results in the treatment of his cancer patients. It was written originally like in German, so it's a translation. The translation I don't think is that good. Do I think the book is worth reading? I'll tell you no. Okay, but what do I think is, why am I even doing a book review about it? There were a few useful things about it. The key point is that he emphasizes, in his opinion, cancer is a systemic disease, meaning that the reason the patient has cancer is not just some focal, isolated event with a mutation in one tissue, but rather systemic, total body, poor health. And as people get older, their immune system atrophies. It doesn't work as well, and I think that's the major reason they get more cancer. And the whole body over time keeps accumulating atherosclerosis, decreasing tissue oxygen delivery. So cells with less oxygen are less able to keep themselves healthy, more likely to switch into anaerobic metabolism, which is a precursor to cancer. Also, chronic inflammation increases the risk of cancer. I've talked about this before in my other lectures, the idea of hot disease, cold disease, cancer. So hot disease means inflammation that can be relatively chronic. It eventually gets gradually replaced by fibrosis, scar tissue, collagen. That traps normal cells and makes them hypoxic, and then as they're hypoxic, they can revert to becoming anaerobic instead of aerobic. So like switching to become like an anaerobic bacteria. That's why the typical cancer burns through 100 times more glucose than does a normal tissue. That's why PET scans are positive. Okay, so what was interesting about the book? He says you need to treat the entire patient. You need to make them as healthy as you can, because if the person is healthy, their immune system works better, and then it's the immune system that removes the cancer. And, he's not the only one that said that. A lot of people have said that. Dr. Day says that. Dr. McDougall, to some extent, says that indirectly. Okay, other people who've survived are basically indicating that that's what they think is going on, like, Ruth Heydrich and other ones. Okay, he does mention, this is not well known by a lot of people. He knows a lot more about dentistry than other people typically do. He mentions the concept of bacterial pleomorphism. One bacterial species can change into another, and they know that because they can stain it in different ways. Depending on, it'll grow as one or the other, depending on its microenvironment, how much oxygen's available, what food's available, for example. He says always avoid processed food, always avoid industrial chemicals, manage your stress to reduce it. He made a good point again. The skin is like a kidney. So people who know skin, when you sweat, you get out toxins. You don't just sweat salt, you sweat out toxins. So that helps improve immune function. The bottom line is the goal of therapy is to optimize tumor microenvironment. It's a little bit like the concept of terrain therapy in infectious disease. That the most important thing is make yourself healthy, and then you're unlikely to ever get an infection in the first place. So the most interesting thing about the whole book was he felt that people should get all their amalgams removed, root canals removed, and even bilateral tonsils, potentially, because he thinks those often harbor infections even when they look relatively good. He does claim to have good results for treating cancer. He said that 20% of cancers are cured by conventional methods, and that certainly would depend on your sample set. Okay, what kind of patients going in had the cancers? There's a lot of variables in that. In general, chemo tends to work well for some of the rare cancers. It doesn't tend to work that well for the solid tumors. You'd have to check for each individual cancer and subtype and whatnot. What was bad about the book? He's kind of long-winded. He kind of goes on and on like a bit of a pompous blowhard. And, I just kind of got sick of the book. I couldn't even finish it. I was so sick of the book. I got about 3/4 of the way through, and I found the book annoying. So this is what is unique. Getting your amalgams out because the mercury is suppressing your immune system. Getting your root canals out because the thioether toxins can damage your body's overall health. And possibly removing the tonsils even if you feel healthy. So who should do this? I'm not sure how to answer that question, but it would seem to me is if you're not getting better, you need to pull out all the stops, and this might be some relatively easy stuff you could do in comparison with other things. So it might be part of a whole healthy picture. If I had cancer, I would optimize. I already optimize my health pretty intensely, but I would do it even more. Dr. Day recommends, take a lot of time off from your job or quit your job and just focus on getting healthy. So, there's obviously a lot more to it. I made tons of videos on cancer. I got a whole playlist of videos on cancer. But this was the most interesting thing, this idea of get all the problems out of your mouth, because, the way I would look at that from a mechanistic point of view is mouth problems, you either got the toxins in the amalgams, the toxins in the root canal, the toxins in other dental implants, and then you've also got the potentially chronically infected tonsils that are going to lead to bacterial endotoxins getting into the blood, causing amyloid. Same thing as fibrinolytic clotting. That's going to make tissue hypoxic. Hypoxic tissues at more risk for hypoxia-induced mitochondrial injury, subsequent conversion of the cell from aerobic to anaerobic metabolism, and then that's a precursor to potential cancer. So anyways, that was the best thing about the book. Hope you found this helpful.